TV 11 News at 5 begins now.
The season's flu epidemic is putting much-needed blood supplies under high strain.
That's because so many regular donors are ill or taking care of sick family members and they can't make it to their appointments. So Arkansas Blood Institute is urging all healthy adults to give the gift of life. As long as you don't have symptoms of the flu and haven't had them for a full week, you can donate.
It only takes about an hour and a single donation can save up to 3 lives. No appointment is needed at the Arkansas Blood Institute, and we'll have more on this story tonight on THV 11 News at 10. State health officials are expecting another jump in flu cases in their weekly report tomorrow, and we've just learned the governor will join them for a press conference about that tomorrow at 1 p.m.
We have talked for weeks about how to avoid getting the virus, but it's awfully hard right now. So if you do have it, THV 11's Relly Hoyt has tips on what not to do if you're sick.
Denise and Dawn, repeat after me. Don't go to work. Don't go to school. Don't spread the virus anymore. We got the obvious things out of the way. Now let's ask a couple of doctors some other ways that we can get through this flu as quickly as we can.
Flu has really become essentially a pandemic over the last few months.
Dr. Wendell Pahls has seen a few flu seasons in his time leading the ER at Baptist Health. This one is bad.
This year's flu is a little bit more intense in its symptoms than some previous flus.
So now that so many friends and neighbors have the virus, what do we need to avoid to get through it? Dr. Grandma famously had her ways. Are any of them bad for you? What about alcohol?
The old wives' tale of take a bunch of whiskey and then go to sleep is probably not in your best interest.
Oh man, I guess there's a medical reason for that.
Alcohol tends to make you a little bit dehydrated. It promotes urination. And when you are sick with the flu, one of the most important things you do is keep yourself hydrated.
Hydration is key to feeling better, so is breaking the fever. Don't latch on to just one pain reliever like Tylenol or Advil.
What we currently recommend is to use an appropriate dose of either ibuprofen or acetaminophen, and then 3 hours later alternate with the other agent.
From a public health standpoint, experts say staying fit will cut down flu dangers.
Most otherwise healthy people, their body, their immune system is going to be able to fight off the flu.
But once you get it, consider quitting smoking. I mean, you're already feeling miserable.
Obviously, we recommend that anyone who's a smoker would quit smoking for lots of reasons, but especially influenza is very hard on the lungs.
So don't smoke them if you got them, but please don't spread it if you got it. Don't go to the ER unless you're seriously ill.
If someone is really struggling to breathe, or if they are so ill they're having trouble functioning, or they appear to be so dehydrated that they can't keep up with it at home, then they need to come to the emergency department.
Now, the other big thing to remember, both doctors mentioned this, don't forget to wash your hands. That's how we keep it from spreading. Coming up at 6, the docs will weigh in on some more remedies and a simple way to decide whether to try them or not.